If you were to estimate the percentage of high-risk patients in the Omicron era who weren't treated as outpatients and ended up hospitalized, what would your answer be? I think a lot of you would be surprised to learn that it's around 94%. Of those patients hospitalized, 17% died. This could be avoided in so many cases, but outpatient treatment remains underused. It's up to us as healthcare professionals to identify patients at high risk for progression, treat them as outpatients, and do our best to prevent them from being hospitalized or dying. So how do you decide whether to initiate antiviral treatment for outpatients? Well, we want to treat outpatients with mild to moderate COVID and risk factors for progression to severe disease, hospitalization, or death. So these patients have symptoms like fever and chills, cough, headache, muscle aches, fatigue, and shortness of breath, but not severe enough to require supplemental oxygen. The COVID-specific antivirals I'll be discussing in this course are the first-line therapies, nirmatrelvir, ritonavir, and remdesivir, as well as the second-line therapy, molnupiravir. Your clinical evaluation will help you identify high-risk patients who meet the criteria for antiviral therapy. It should include the date of symptom onset. This is because antivirals will be most effective when the infection is early, and the viral load, or the amount of virus in the patient's blood, is high. These antivirals are approved to be initiated within 5 to 7 days from symptom onset. It really should be the time from symptom onset, not from the first positive COVID test. While you can do a COVID test, you don't need to wait for a positive test to determine if you're going to treat. This was the case in the past, but since February 2023, it can be based on clinical diagnoses. Your evaluation should also include the severity of the symptoms because, remember, we want to treat those with mild to moderate disease. Next, include the differential diagnosis. Be sure it's COVID causing the symptoms and not something else. Use your clinical judgment based on the patient's symptoms and exposure. Don't get tunnel vision just because of a positive test. What if someone is COVID positive, but the symptoms are indicative of something else, like bacterial pneumonia? Also note their vaccination status. Are they vaccinated? Unvaccinated individuals have an increased risk of progression to severe disease. Are they up to date with vaccinations? A prolonged time since the last vaccination is a risk factor for progression. The guidelines give the example of more than 6 months, but this may change in the future. Lastly, be sure to include risk factors for progression to severe disease, death, or hospitalization. The CDC has a great list of these, so please check that out. Some at the top of the list are older age, which is the strongest risk factor. More than 81% of COVID-19 deaths occur in people over age 65. One or more underlying conditions, especially respiratory illnesses like asthma and chronic obstructive pulmonary disease, or COPD. But other conditions are also important to consider, like obesity, diabetes, cerebrovascular disease, for example, a stroke, dementia, and chronic heart, kidney, or liver disease. Immunocompromising conditions like cancer and the use of steroids by transplant recipients, as well as pregnancy. Finally, let's address a concern that's been floating around for a while: treatment and rebound COVID-19, which is a new positive test or the recurrence of symptoms after an initial recovery. The CDC did a study on this concept and found no cause-effect relationship between any treatment and rebound COVID. They say rebound shouldn't deter providers from prescribing life-saving antiviral treatments when indicated to prevent morbidity and mortality from COVID-19. We've created a treatment checklist summarizing important factors in outpatient treatment decision-making. It includes risk assessments, key drug interactions, dose adjustments, and management strategies. You can download it from the course resources section to help you decide when to initiate treatment.